It's 11:30 at night. You've just finished a delicious dinner with your family. Maybe it was pasta with marinara sauce, perhaps some grilled chicken with vegetables, and you're feeling satisfied, content, ready to relax. You settle into your favorite chair to watch some television, maybe scroll through your phone for a bit, and within 30 to 45 minutes you decide it's time for bed. You brush your teeth, get into your comfortable pajamas, climb into bed, and drift off to sleep. Sound familiar? If you're nodding your head right now, I need you to understand something that could literally save your life. You just made a mistake that millions of Americans make every single night. A mistake that's slowly destroying your esophagus, setting you up for a condition called Barrett's esophagus, and potentially putting you on a direct path to esophageal cancer. I'm Dr. Michael Hayes, board-certified gastroenterologist with 22 years of experience treating digestive disorders, and what I'm about to share with you is based on decades of research, thousands of patient cases, and recent studies that have completely changed how we understand the relationship between eating timing and severe acid reflux disease. This is educational content only, not medical advice, and you must consult your healthcare provider before making any changes to your treatment plan. Individual results may vary, and this information is meant to complement, not replace, professional medical care. But here's what most people don't realize. The average American eats dinner between 6 and 7:30 in the evening, then goes to bed between 10 and 11 at night. That's only 2.5 to 3 hours between eating and sleeping, and according to research published in the American Journal of Gastroenterology, this timing is one of the primary triggers for nighttime gastroesophageal reflux disease, commonly known as GERD. Join the thousands of people who have already subscribed and transformed their digestive health by hitting that subscribe button now, because this community is growing and you don't want to be left behind with outdated information. Now let me tell you about Linda, a 63-year-old retired teacher from Florida who walked into my office 6 months ago looking exhausted, frustrated, and frankly scared. Linda had been experiencing severe nighttime reflux for almost 3 years. She described waking up at 2 or 3 in the morning with what she called a burning sensation rising like molten lava from her stomach into her throat, combined with chest pain so intense she genuinely thought she was having a heart attack the first few times it happened. She told me she had been to the emergency room twice, had multiple EKGs to rule out cardiac issues, and had spent thousands of dollars on over-the-counter antacids, prescription proton pump inhibitors, and even tried sleeping in a recliner chair because lying flat had become unbearable. When I asked Linda to walk me through her typical evening routine, here's what she described. She'd eat dinner around 6:30, usually something she considered healthy like grilled fish with rice and vegetables, or a chicken salad, or sometimes pasta with a light sauce. She'd clean up the kitchen, maybe watch the news or read for a bit, then head to bed around 9:30 or 10. She thought she was doing everything right. She avoided spicy foods, didn't eat fried items, cut out coffee completely, and even stopped drinking wine with dinner. But despite all these efforts, the nighttime reflux continued, night after night, week after week, month after month. Here's what Linda didn't know, what her previous doctors hadn't explained, and what I see missed in probably 70% of reflux cases. It wasn't just what she was eating, it was when she was eating relative to when she was lying down. When you eat a meal, your stomach immediately begins producing acid to break down the food. This is normal, healthy, necessary. But here's the critical part. It takes your stomach approximately 3 to 4 hours to empty its contents into your small intestine. During those 3 to 4 hours, your stomach is full of food mixed with powerful digestive acid. Now, when you're sitting upright or standing, gravity helps keep that acidic mixture in your stomach where it belongs. But the moment you lie down, especially within 2 to 3 hours of eating, you've eliminated gravity as a protective factor. Suddenly, that pool of acidic, partially digested food can much more easily push past your lower esophageal sphincter. That's the muscular valve that's supposed to keep stomach contents from flowing backward into your esophagus and splash up into your throat. With Linda, we did something simple but powerful. I had her keep a detailed diary for 2 weeks, noting exactly when she ate, what she ate, when she went to bed, and when she experienced reflux symptoms. The pattern was crystal clear. On nights when she ate dinner at 6 and went to bed at 10:30, giving her stomach 4.5 hours to empty, she had minimal to no symptoms. But on nights when she ate at 7:30 and went to bed at 10, or worse, when she had a late snack at 8:30 and went to bed at 10, she woke up between 2 and 3 in the morning with severe burning and chest pain like clockwork. This wasn't a coincidence, this was cause and effect. Comment below and tell me, how long have you been dealing with nighttime reflux? I read every single comment and I want to hear your story. Now let me explain the anatomy of what's actually happening inside your body when you make this timing mistake, because understanding this will help you appreciate why the solution works so effectively. Your esophagus is a muscular tube approximately 10 inches long that connects your throat to your stomach. At the bottom of your esophagus, right where it meets your stomach, there's a ring of muscle called the lower esophageal sphincter, or LES for short. Think of the LES as a one-way valve or a drawstring on a bag. When it's working properly, it opens to let food and liquid pass down into your stomach, then immediately closes tight to prevent anything from coming back up. This valve is incredibly important because your stomach is designed to handle acid, your esophagus is not. The lining of your stomach has special cells that secrete a thick protective mucus layer that shields the stomach tissue from the hydrochloric acid your body produces for digestion. This acid is strong enough to dissolve metal. If you put a nail in a beaker of stomach acid, it would completely disintegrate within hours. Your esophagus, however, has no such protection. The esophageal lining is delicate, sensitive tissue similar to the inside of your mouth. When stomach acid repeatedly washes up into your esophagus, it causes inflammation, irritation, and over time, actual cellular damage. In the short term, this damage manifests as the burning sensation we call heartburn. But here's where it gets serious, and this is what Linda was facing without even knowing it. When acid reflux happens repeatedly over months and years, your esophageal cells can undergo something called metaplasia. This is when the normal esophageal cells, damaged beyond their ability to repair themselves, are replaced by cells that are more similar to intestinal cells. This condition is called Barrett's esophagus, and it's a precancerous condition. People with Barrett's esophagus have a 30 to 40 times higher risk of developing esophageal adenocarcinoma compared to the general population. Esophageal cancer is one of the deadliest cancers, with a 5-year survival rate of only about 20%, primarily because it's usually diagnosed late. Now, your LES is designed to stay closed except when you swallow, but several factors can weaken it or cause it to relax inappropriately. One of the biggest factors is pressure. When your stomach is full of food and acid and you lie down flat, the pressure of all that stomach content pushes against the LES from below. If the LES is even slightly weakened, whether from age, diet, medications, or other factors, that pressure can force it open, allowing acid to escape upward. Additionally, certain body positions make this worse. When you lie on your right side, due to the anatomical position of your stomach, which sits primarily on the left side of your abdomen, and the way your esophagus connects to your stomach at the upper left portion, lying on your right side essentially creates a pool of acid right at the gastroesophageal junction. It's like tilting a pitcher of water so the spout is facing downward. Gravity pulls the liquid exactly where you don't want it. This is why sleep position matters enormously, but we'll get to that in detail later. For now, understand this. Every time you lie down within 3 hours of eating, you're forcing your LES to work against gravity and pressure simultaneously, and you're setting yourself up for reflux. Over weeks, months, and years, this creates a vicious cycle. The more reflux you have, the more inflammation and damage occurs. The more damage occurs, the weaker your LES becomes. The weaker your LES becomes, the more reflux you experience. Eventually, you end up like Linda, trapped in a nightmare of nighttime symptoms, medications that only partially work, and mounting fear about what's happening to your body. Now let me explain the approaches that don't work, and why, because I see patients try these constantly, and they're wasting time, money, and allowing damage to continue. Wrong approach number 1. relying solely on antacids or proton pump inhibitors without changing timing. Look, I prescribe PPIs regularly, they have their place in treatment, but here's the truth. Medications like omeprazole, pantoprazole, or esomeprazole work by reducing the amount of acid your stomach produces. They don't fix the mechanical problem of acid escaping your stomach and entering your esophagus. If you eat at 8 at night and go to bed at 10, even with reduced acid production, you still have stomach contents pushing against a weakened LES while you're lying flat. You might have slightly less burning because the acid is less concentrated, but the reflux is still happening, the damage is still occurring, and you're masking symptoms without addressing the root cause. Plus, long-term PPI use, we're talking months to years, has been associated with increased risk of bone fractures, vitamin B12 deficiency, magnesium deficiency, and some studies suggest possible increased risk of kidney disease and dementia, though more research is needed on those associations. I'm not saying PPIs are bad. I'm saying they're not a complete solution if you're still eating dinner at 7:30 and sleeping at 10. Wrong approach number 2, elevating just your head with extra pillows. I see this recommendation everywhere, and patients come in telling me they're sleeping on 3 or 4 pillows stacked up, and they're still having symptoms. Here's why this doesn't work effectively. When you elevate just your head and neck with pillows, you're creating a bend at your mid-back or neck, but your torso from your waist to your shoulders is still relatively flat. This creates a kind of kinked position that can actually increase abdominal pressure and make reflux worse for some people. Additionally, during sleep, you shift positions, and those pillows get moved around, flattened, or kicked aside. What actually works is elevating your entire upper body from the waist up by raising the head of your bed itself by 6 to 8 inches using blocks under the bed legs or using a wedge pillow that supports your entire torso. But even this intervention is only partially effective if you're still lying down with a full stomach. Wrong approach number 3, eating smaller meals but eating them late. Some patients tell me they've switched to eating smaller portions for dinner, thinking that less food means less reflux. And yes, smaller meals do produce less stomach distension and less pressure on the LES, so there is some benefit. But if you're eating that smaller meal at 8 or 9 at night and going to bed at 10 or 11, you're still lying down while your stomach is actively digesting, still creating the opportunity for reflux, and still risking damage. The volume matters, but the timing matters more. I've had patients who eat a huge lunch at noon, then a very light dinner at 5, and go to bed at 10, and they do dramatically better than patients who eat a light snack at 9 and go to bed at 11. It's not just about how much you eat, it's about giving your stomach time to empty before you assume a horizontal position. So, what's the correct solution? What actually works to stop nighttime reflux, heal your esophagus, and potentially get you off daily medications? It comes down to 4 fundamental steps that work with your body's natural physiology instead of fighting against it. Step 1. Implement the 3 to 4 hour rule. This is non-negotiable if you're serious about stopping nighttime reflux. You must finish eating your last meal or snack of the day at least 3 to 4 hours before you lie down to sleep. If you plan to be in bed at 10:30, your last bite of food needs to be consumed by 6:30 at the absolute latest, preferably by 6. This gives your stomach the time it needs to empty its contents into your small intestine. By the time you lie down, your stomach should be mostly empty, dramatically reducing the volume of material that could potentially reflux. Now I know what you're thinking. I get hungry before bed, or my schedule doesn't allow me to eat that early, or I have dinner with family at 7 and I can't change that. I hear these concerns every day in my practice. Here's how we work around them. If your family eats dinner at 7 and you can't change that social dynamic, then you need to push your bedtime to 11 or even 11:30 to maintain that 3 to 4 hour window. If you go to bed at 9:30 because you wake up at 5 for work, then you need to eat dinner by 5:30 or 6, even if that means eating separately from your family or preparing a meal you can eat earlier. If you get genuinely hungry before bed after eating early, you can have a very small, low reflux snack like a few crackers or a small banana, but keep it minimal, under 100 calories, and make sure it's at least 90 minutes before lying down. The key is understanding that this timing isn't a suggestion, it's a requirement if you want to stop the damage. Step 2. Elevate the head of your bed by 6 to 8 inches, not with pillows, but by actually raising the bed frame itself. You can buy bed risers at any home goods store for $20 to $40. They're blocks that go under the legs at the head of your bed. Alternatively, you can use a wedge pillow specifically designed for reflux. These typically cost between $50 and $100, and they elevate your entire upper body at a gentle incline. This elevation uses gravity to help keep stomach contents where they belong. Even if some reflux does occur, the acid has to travel uphill to reach your esophagus, making it much less likely. This is especially important during the first few hours of sleep when your stomach may still have some residual content. Step 3, and this is crucial, sleep on your left side. Here's the anatomy behind this. Your stomach is positioned on the left side of your abdomen, and your esophagus connects to your stomach at the upper left portion. When you sleep on your left side, the gastroesophageal junction, that's where your esophagus meets your stomach, is positioned above the level of stomach acid due to the natural curve of your stomach. Gravity keeps the acid pulled away from the junction. Multiple studies, including research published in the Journal of Clinical Gastroenterology, have demonstrated that left-side sleeping significantly reduces acid exposure in the esophagus compared to right-side or back sleeping. When you sleep on your right side, the anatomy works against you. The junction ends up lower than the acid pool, making reflux much more likely. Back sleeping is somewhere in between, but generally worse than left-side sleeping. To maintain left-side sleeping, try placing a body pillow behind your back to prevent rolling over, or put a pillow between your knees for comfort. Your upper knees should be slightly flexed, and you can hug a pillow in front of you for arm positioning. It takes about a week to get used to this position if you're normally a back or right-side sleeper, but the improvement in symptoms makes it absolutely worth the adjustment period. Step 4. Implement a pre-sleep ritual that supports digestion. After dinner, take a 10 to 15 minute walk. This gentle movement helps with gastric emptying and prevents food from just sitting in your stomach. Wear loose-fitting clothing, especially around your waist and abdomen, because tight belts or waistbands increase abdominal pressure and can promote reflux. Avoid alcohol for at least 3 hours before bed, as alcohol relaxes the LES and increases acid production. Avoid caffeine for at least 6 hours before bed. This includes coffee, tea, chocolate, and some sodas. Stay upright, either standing or sitting, for at least 2 to 3 hours after eating. No lying on the couch to watch TV immediately after dinner. These 4 steps work together synergistically. The timing ensures your stomach is empty. The elevation uses gravity as a protective factor. The left side sleeping optimizes anatomy, and the pre-sleep ritual supports the digestive process. When Linda implemented all 4 of these steps, here's what happened. Within the first week, she noticed she was waking up less frequently during the night. By week 2, the burning sensation had decreased by about 60%. By week 4, she was sleeping through the night most nights without any reflux symptoms. By month 2, under my supervision, we were able to reduce her PPI dose by half. By month 4, she was completely off daily medication and only taking an antacid maybe once every 2 weeks if she made an exception and ate later than usual. Her follow-up endoscopy 6 months later showed significant healing of the esophageal inflammation that had been present initially. This isn't a miracle. This is basic physiology working the way it's supposed to when you stop fighting against it. Now let's talk about what foods to avoid and what foods are safer, because this matters too, especially during that dinner meal. High trigger foods that increase reflux risk: chocolate because it contains methylxanthine, which relaxes the LES, caffeine from coffee, tea, or soda, alcohol, spicy foods with hot peppers or heavy spices, citrus fruits and juices like oranges, grapefruits, lemons, tomatoes and tomato-based sauces, mint, including peppermint and spearmint, high-fat foods like fried items, fatty cuts of meat, or heavy cream sauces, onions and garlic for many people, and carbonated beverages which increase stomach pressure. Safer foods that are less likely to trigger reflux: oatmeal, bananas, melons like cantaloupe or honeydew, green vegetables like broccoli, green beans, asparagus, lean proteins like chicken breast, turkey, fish, whole grains, ginger, which actually may help reduce nausea and inflammation, and small amounts of aloe vera juice, about 1 to 2 ounces, which some studies suggest may soothe the esophagus. Your dinner should focus on these safer foods, prepared simply without heavy sauces or frying. You need to understand the warning signs that indicate your reflux has become serious enough to require immediate medical evaluation, because while the steps I've outlined work for most cases of GERD, there are situations where you need professional intervention urgently. Seek immediate medical attention if you experience severe chest pain that radiates to your arm, jaw, or back, because this could indicate a heart attack, not reflux. Difficulty swallowing solids or liquids, which could indicate esophageal narrowing or stricture. Vomiting blood or material that looks like coffee grounds, which indicates bleeding in your digestive tract. Black, tarry, or bloody stools, also indicating bleeding. Unexplained weight loss of more than 10 pounds without trying, which could indicate cancer or other serious conditions. Persistent heartburn despite medication and lifestyle changes lasting more than 2 weeks, because this suggests the need for endoscopy to evaluate for Barrett's esophagus or other complications. Chronic cough with blood or severe shortness of breath. Hoarseness lasting more than 2 weeks. Pain when swallowing accompanied by fever, which could indicate infection. Choking episodes during sleep, which could indicate severe reflux or aspiration. Call 911 immediately if you have chest pain with sweating, shortness of breath, or pain radiating down your arm, as these could indicate a heart attack, not reflux. This is educational content only, not medical advice. Consult your healthcare provider before making changes to your treatment plan. Patient details have been changed to protect privacy, and this represents a composite case example based on typical presentations I see in clinical practice. Now let me give you realistic expectations for improvement, because I want you to know what to expect. Night 1. You may notice slight improvement, and if you do wake up with reflux, you'll likely find it easier to fall back asleep because the symptoms are less severe. Days 2 and 3. You should experience reduced frequency of nighttime awakenings, maybe going from waking up 3 or 4 times to waking up once or twice. Week 1. Noticeable reduction in the burning sensation, better overall sleep quality, waking up feeling more rested. Weeks 2 through 4. Significant improvement in symptoms. You may find that you can reduce medication needs, but only do this under your doctor's supervision. Never stop PPIs abruptly, as this can cause rebound acid production. Month 2 and beyond. Sustained improvement, potential healing of esophageal tissue, which can be confirmed with endoscopy if needed, and dramatically improved quality of life. You'll sleep better, wake up without that awful burning or bitter taste, have more energy during the day, and significantly reduce your risk of developing Barrett's esophagus or esophageal cancer. Here's what I need you to understand on a deeper level. Every night you continue eating late and lying down with a full stomach is another night of acid damage to your esophagus. Every night of damage increases inflammation. Every night of inflammation pushes you closer to cellular changes that could become precancerous. This isn't fear-mongering. This is medical reality based on decades of research and thousands of endoscopy procedures I've personally performed. I've seen patients in their 40s and 50s with severe Barrett's esophagus who could have prevented it entirely if they had understood these timing and positioning principles 10 years earlier. I've seen patients develop esophageal strictures, narrowing of the esophagus that makes swallowing difficult, requiring repeated dilations, uncomfortable procedures where we stretch the esophagus, all because chronic reflux caused so much scarring. I've diagnosed esophageal cancer in patients who thought their heartburn was no big deal and didn't take it seriously until it was too late. I'm not trying to scare you, I'm trying to wake you up to the reality that what seems like a minor annoyance, a little heartburn, some chest discomfort, is actually your body warning you that damage is occurring. If this video helped you, I need 3 things. First, smash that like button because it tells YouTube to show this to more people who are suffering. Second, Share this video with anyone you know who complains about heartburn or takes antacids regularly. You could literally save them from years of damage. Third, comment below committing to one specific change you're making tonight, because accountability matters. And if you're not subscribed, what are you waiting for? Hit that button now.